Hello, Dr. Sammy here, guys. So we're going through some of our questions, and one that reoccurred a few times was anal glands in dogs. And we're going to talk about anal glands. So for those of you that don't know what an anal gland is, basically there's this little sac around the rectum, and in the wild they would use them whenever they would defecate. They release these secretions, aka from the anal glands, and basically scent marking. It's a way to mark their territory, boundaries, things like that. That's why some wild animals, they would poop along their borders and check them and do different things. Or when they're just passing through, another animal coming through a day or two later will sniff where they peed or pooped, and basically it's a way of tracking and identifying. So that's kind of what anal glands are for the most part. In our domestic animals, in our dogs and cats, they really don't use them a whole lot for marking. They're domesticated. They're supposed to excrete when they go poop. So when they poop, there's anal glands on the left and the right, excrete, and they put anal gland juice on the poop and defecate and move forward. So that's kind of what they do. Once again, for our purposes, domestic animals, they're a non-essential organ at this point in time. They don't use them anymore other than just for sniffing. They do cause some problems here and there. The main question was, how frequent do we need to look at them, express them, do things? There's no one straight answer for that. Every patient's a little bit different. I have some patients that we have to do them once a month to keep them from getting abscesses or infections, different issues like that. Cancers can show up back there. The most common type of cancer is in the carcinoma class, which is actually a very aggressive type of cancer. And they do get some other issues like perianal fistulas, basically a big hole in the back where the anal gland is, and an infection, and it kind of eats its way in the body, is a way of thinking about it. Kind of the way I'll explain it to clients is perianal fistulas are like a cave. You don't know how big and deep they are till you get to the back of it. Usually you gotta have CT scans and some of those things, or you're just exploring it surgically when you find them. When you have to do the surgery, you have to do it. It's not a fun surgery, it's a complicated surgery. There are risks with the surgery, and there can be recurrence even with surgery. And it's a difficult surgery, and I've seen multiple doctors that have been doing it for years and years have issues and reoccurrence and things like that. And even the specialists have issues with them. So hopefully you all don't have those. We don't have to deal with perianal fistulas because they are problematic for many patients when they develop. Good news is they're rare. Yay, rare. Back to the original question, how frequent do we have to express the anal glands? Every patient is different. Some we have to do once a month, some are every 3-4 months, some are just once a year, and that's it. So watch your dogs. Some of the big signs for them is they'll tend to be scooting a little bit more. If you see it and it's persistent, touch base with your veterinarian, ask them to get them expressed. There's a couple different ways of expressing them. What I've been told is a lot of groomers express them from the outside. Here and at most clinics that I've been to and worked when I was doing relief work, kind of do it internally. And what that means is we put a glove on, lube, we stick our finger in the rectum and we get behind the anal gland and express it. In my opinion, that expresses it much more fully than just squeezing on the outside and the outside of the anal gland. And like I said, a lot of groomers, that's how they do it. Whether it's a legal issue or a comfort issue, I'm not quite sure. I haven't looked into it that much. So hope that helps you guys a little bit, and wish there's a little more straightforward answer to it, but every patient's a little bit different. And there's just so many variables. So hope that's helpful for you guys. Hope you're enjoying these videos. Hope they're useful for you. We'll see you around. Bye.